If you were into the funky fashions of the 80s,
My mom won't let me near suede.
you know it was all about big hair
I don't know, let me finish.
No, I gotta get there. We gotta get there, Lynn.
and bigger earrings. Sari Jacob was a material girl of that time.
Very heavy rhinestone earrings, which were very popular back in those days.
Like many women, she's now paying for those super-sized styles. Her earlobes are all stretched out, and she can't show off her favorite diamond studs.
Recently, I've noticed that whenever I put earrings on, they droop. I'd like them to be like this, where they just stand up and they don't hang down.
Adrienne Rolls would love to wear big earrings again, but she's self-conscious because one earlobe hangs down further than the other.
I can't wear them because my ears are completely uneven. Hi, good morning. This is Adrienne Rolls. How are you today?
She blames her uneven lobes on years of yapping on the phone.
I do often talk on the phone on the left side, and I notice that seems to be the ear that's more droopy.
Heavy earrings and the telephone aren't the only causes to sagging earlobes. As we age, and this is a little depressing, our earlobes, just like our face, over time lose volume.
The fat disappears, and if all the earring is sitting on is the skin, it has a tendency to sag.
Now, in the past, the only option was surgery to sew up the earlobe. But now, dermatologists are actually injecting facial fillers into sagging earlobes to plump them up.
What we were doing is putting these hyaluronic acids in to replace that volume that's lost. And by doing that, you're plumping it up kind of like a little balloon, and then the earring sits in nice and tight.
All it takes is a few injections around the base of the lobe. Doctors don't even touch the actual earring hole. And unlike when injected into the face, fillers in the earlobe should last at least 1 year because the earlobe doesn't move much. After just one treatment, Sari's earlobes don't sag anymore. She's ready to dazzle in her diamonds.
They look so much better. They don't hang off my ears.
The injections also evened out Adrienne's earlobes. And now she's dreaming of bigger things.
I'll be going out to buy some nice, great big hoop chunky earrings.
Lynn Martinez, 7 News.
I don't get dressed up that often. I'm gonna do it right.
You won't find any wrinkles on a Hollywood red carpet. Matter of fact, you won't find much of anything except perfection.
More fluffy. Eyebrows. There should be 2.
A good makeover never hurt anyone, but a bad facelift, it can last for years.
If I give you any more collagen, your lips are gonna look like they got stuck in a pool drain.
Sure, a little collagen goes a long way, but what about a facelift with that funny after look?
I look inside myself and see my heart is black.
Say goodbye knife, hello laser.
Are those sharks with laser beams attached to their heads? Cool. You mean I actually have frickin' sharks with frickin' laser beams attached to their frickin' heads?
Okay, not that kind of laser. This kind of laser. Meet Dr. Martin Zayak, dermatologist extraordinaire.
This particular machine is called the Aurora, and it uses a technology called ELOS, which is electro-optical synergy.
Translation, it takes frickin' years off your face.
It tightens the skin a little bit, it decreases the pore size a little bit, it gives a firmness to the skin. It's not going to replace a facelift, but it's certainly for those people that are in between.
At Dr. Zayak's Mount Sinai Miami Beach office, patients are loving this laser.
I had a lot of brown spots. Those are gone. As a matter of fact, I had several moles. They're gone. And the softness and the small wrinkles are gone.
The most improvement in the skin, I think, is a lot in the pore size.
You'll need about 5 to 6 treatments with some microdermabrasion or peels in between. It takes about an hour and comes as a package deal. The cost depends on your skin, and although minimal, it's not pain-free.
And also a lot of the pigmentation. I had some freckles that had faded over the years and looked like little dark spots, so it helped make the skin more one-tone.
I had decided that I wouldn't do a facelift because I see a lot of them. And so I researched for 2 years before I came up with this.
So forget that Joan Rivers pullback. Go with the Aurora laser instead for an aura of pure, unadulterated youth.
So a little pinch, you're gonna feel.
Botox is the #1 cosmetic treatment used to erase facial wrinkles. Lisa Riebel is having it done again today.
And I've never had any adverse reactions to the Botox.
She admits reports of getting botulism poisoning from the toxin after injections is cause for concern.
It does raise an ear.
Botox is produced by Allergan. It is FDA approved and has been used for over 2 decades by more than 20 million people worldwide for up to 30 different medical problems. Until now, there hasn't been one report of illness. How did it happen? Dermatologists say there are several possible scenarios.
The problem is that there is such a demand for this product that there creates a black market for other products that are similar, in quotations, to the Allergan product but have not been approved.
Some of it's coming in from foreign countries. The product could also have been contaminated during preparation, transportation, or the patient got too much.
We don't really know what product was being used in this facility.
Dr. Zayak says you can protect yourself.
I would say that it's totally safe as long as you're using the product that we know is FDA approved through the Allergan Corporation, and that you're having the treatments with a doctor or a provider that knows how to use the product and is well trained. So we're just going to do a little bit right here.
Lisa's sticking to that advice.
It really helps you look great. It makes you look refreshed. It makes you look younger. Anything that's going to make me feel good, I'm going to keep doing it.
The lesson to be learned here is don't just go for what you think is a good deal. Find a doctor who is board certified with a lot of experience, not someone who just took a weekend course in Botox injections. In the Plex, I'm Marilyn Mitzel, 7 News.
Roll out the red carpet, not for the stars, for their beauty secrets.
And I read about it in a magazine that everybody in Hollywood was doing it.
Never let them see you sweat, especially on a big night. We're not talking brows, we're talking pits.
The concept of the fact that this relaxes muscles, anything that involves muscle, the Botox can be used for.
He said Botox. Yeah, it's the wrinkle erasing wonder, but it's also a sweat begoner.
So how's everything going? Good?
Good. Not
right.
perspiring anymore.
Sylvia Bolivar swears by it.
And I was like sweating more than my boyfriend. And I did it, and the next day I wasn't sweating. I even went to the Coconut Grove Art Festival in the middle of the day, and I did not perspire at all.
The procedure is fairly easy. Dr. Zayak makes quick, small injections.
After doing these injections, really, if you're not sweating, there really is no reason to be using any kind of deodorant.
Botoxing your pits is catching on.
And it's fantastic. I don't perspire at all now.
Say goodbye to sweaty days and hello summer, because a little Botox goes a long way, especially on a hot day. For The Drive, with my secret on, I'm Shireen Sandoval.
Every year, more than 1 million people are diagnosed with skin cancer, but a new treatment can prevent it and do a lot of damage control. Leonard Ween has spent most of his life in the sun.
I've played tennis, I've played golf, I've been out in the sun, and now I'm paying the penalty.
As a result, Leonard has a lot of rough, scaly patches of skin on his arms, face, and head. It's called actinic keratosis, or AKs.
At times I'd go to a dermatologist and they'd take off one spot here or there.
They must be removed or they can turn cancerous. The most common treatment for AKs is freezing or burning them off with a topical solution. But now dermatologists think they have a more effective treatment. It's called photodynamic therapy. It can make these lesions disappear before it's too late.
By destroying those lesions early, we're preventing those from developing into skin cancers.
It is a two-step procedure. First, a light-activated medication is applied to the skin. The next day, the patient sits under a special blue light for 16 minutes. The light destroys the diseased cells.
We have 11 and a half more minutes to go.
Oh my gosh.
While it's relatively quick, the treatment can be uncomfortable.
I'm going to spray you now.
At least half of all patients complain of severe stinging or burning while sitting under the light. But after a couple of weeks, 3 out of 4 patients say all of their lesions are gone.
In about 2 weeks or so, all that skin will be removed and there'll be a fresh, newer skin.
See for yourself. Here is Leonard 2 weeks after the treatment. He feels better, but says there's something more important at stake.
I think it's more than cosmetic because if you don't take care of it, it can get worse.
This new photodynamic therapy was recently FDA approved to treat precancerous lesions. I'm Marilyn Mitzel, 7 News.